In the news, we're hearing a lot of talk about seas of nurses leaving the field of medicine.
Mhm.
What do you think is contributing to that?
So many factors. I mean, the nursing shortage is well documented even before the pandemic for so many reasons, not just pay or lack of teachers to actually teach the new crop of nurses to come into the field, but scarcity in nursing schools. So that was already an issue before the pandemic. Now we're 2 full calendar years in the pandemic. At first, nurses were heralded as heroes, and all nurses, I believe, are. Every emergency physician, every allied healthcare professional is a hero in their own, from the radiology tech to the custodian helping on the night shift. That was really put front and center in the beginning of the pandemic. Since then, though, I think it's hard for any healthcare professional to ignore the rancor and vitriol that has surrounded the profession of nursing. Basic rudimentary science that we've all learned and adhered to and believed in is now being questioned by those that it's hard to understand why they're questioning it. And how does all that negative, toxic rhetoric affect those who are on the fence of joining this profession? Like if I was just doing undergrad work, a bio major at the University of Maryland, I don't know what I want to do. A quick Google search on the perspective of nursing right now, maybe I'll just shy away from that profession, right? There's not a lot of positivity still around us and believing in our abilities to help humanity. When we get sick, we are fortunate enough to live in a country where we can walk into any ER, urgent care, and get treatment. And the only way that we're able to get that is by the people in those scrubs that help us when we need it. If those people start dwindling down, we're in a lot of trouble. So I hope that sooner rather than later, we can turn the tide and prop this profession up the way that it should be.
And how could we turn those tides around?
I want to say that it starts with us, but I think we know our value. It has to be wider. It has to be some of those injecting this toxicity into society to come to some type of realization. At some point, we need to put those egos aside and realize the damage that is being done in society at large. There needs to be more advocacy for nurses. It needs to be more widespread at a local level to promote more community activism to get into our profession.
What about retention of the ones that currently are? Because if you feed people into the system, but you can't keep them in there, then is it beneficial?
That's a fantastic point. Retention's big. If you're a staff emergency nurse, you may make $60,000, $70,000, $80,000 a year. If you're a travel nurse and willing to go from Maryland to Minnesota to California to Florida on a whim, you can probably make $100,000 in 6 months. Pay, sadly, is always going to be a driving motivator, and it's hard for somebody to stay loyal to an organization they've been with for 5 or 10 years making the same salary when this nurse coming from Maine can make double their money in 13 weeks. So I think first you have to make people right financially. Then it's what other things do you offer? Like we were talking about burnout before. There are still some organizations that don't necessarily realize the impact, the psychological and mental impact that being in this profession takes. The ones that do invest in that. So giving the opportunity for mental counseling free of charge to help employees through these hard times, financial planning and services, obviously top-notch benefits and healthcare. You have to invest in a person holistically.
For us, by us, and just for us, this is Hope for Med.